Hello, everyone. We are going to go ahead and get started because we have so many things planned today. So if you could go to the next slide, please. So just a bit of housekeeping. If this is your first time, we are super excited that you could join us today. This is actually our next edition of this Wednesday briefing series that we're doing, where we provide updates on the congressional budget cuts on a weekly basis, whether through the form of a webinar, an email, or maybe even something else. I would also like to say that recordings of the webinar and the slides will be sent to all registered participants after it is done. And as for Q&A, if any questions arise to you throughout the briefing while any of our speakers are talking, please be sure to put that question in the Q&A box, which can be found at the bottom of your screen. And as a reminder, we want to make sure that this is engaging as well. So if any thoughts come up as our speakers are talking, please feel free to put those in the chat as well. Any reactions, anything that you might find intriguing. And one more thing regarding reactions, if you see that react button down at the bottom of your screen as well, if anything does intrigue you or anything that is being said you really like, please be sure to use those reactions because we like to see them as we are speaking. So in terms of engagement, if you could start, and I see some of you are already doing it, but if you could start with putting your name, your organization, and the county that you currently reside in. Next slide, please. So our speakers, so I'm sure you are looking and saying that this is a new face. My name is Danielle Branch. I am your moderator for today. I am the Health Policy and Advocacy Associate on the health team, so everything that I do surrounds Medicaid. And then, of course, we have our two amazing speakers as well that you know and love. First, we have Gordon Bonnyman on Medicaid. He is one of our co-founders as well as one of our amazing staff attorneys here at TJC. And then, of course, we have Signe Anderson, who is our Senior Director of Nutrition Advocacy, and she will be giving us our deeper dive on all things SNAP. Next slide, please. So before I jump into, before I pass things off to Gordon and Signe, I'm just going to provide a bit of background information over what's been going the past few days, and since the beginning, really. So the reality is that Congress is trying to create this mega bill through the budget reconciliation process. They've decided to cut about, or really more than $1 trillion from the safety net programs. That being $880 billion from Medicaid and $230 billion from SNAP. And the truth is that the House Republicans are the majority and they're drafting the bill for these cuts. Nonetheless, there are still disagreements amongst them. Next slide, please. So even though Republicans are the majority in the House, it's a very slim margin, meaning that it would only take a few folks to block the bill. And so as I said before, they are disagreeing among certain things. So for example, moderate Republicans are threatening to oppose the bill to cut Medicaid if the cuts are too deep, whereas hard right members they're holding up the process with hopes of even deeper cuts to be made into last week's version. So nonetheless, they still are keeping the process moving, but they're doing it so that it's keeping away from the limelight or the spotlight of folks. So for example, they actually had a hearing this morning that started at 1 a.m. as well. Next slide, please. So speaking on the timetable, so President Trump has really been pressuring members of both the House and the Senate to pass this current bill as fast as possible. But the reality also is that Republican leadership in the Senate, they're facing a similar dilemma where they have a slim majority, but hard right Republicans want deeper cuts and moderate Republicans will oppose if they are too deep. Nonetheless, the Senate committees are working on their proposals and they are not planned to meet before June 23rd. Next slide, please. The last thing that I will say is that Congress has to raise the debt ceiling by the end of July. And of course, we know that the mega bill will actually add trillions of dollars to our national debt. So this makes it really hard, especially when all of our House members and a third of senators face midterm elections as well. Next slide. So I am now going to pass it off to Signe to speak further on SNAP cuts.
Excellent. Thanks, Danielle. Great to be here with everybody. You can change it to the next slide. I'm going to dive in and share more details on SNAP and the proposed SNAP cuts. First, starting off with the big picture. So last night, or I guess early this morning, the House Rules Committee gavelled in at 1 a.m. and they are still going. I was watching the debates just before getting into this meeting, but so they're debating SNAP and talking about some of the largest SNAP cuts in history. There will be 3.5 million who may lose SNAP benefits if they move this bill forward. And also last week and weeks prior to this, we've reported a lower cuts, but that's increased in the past week. So the House amendments will cut 300 billion from SNAP. And one of the major changes that have helped increase this cost is a major cost shifting to states. And they haven't shared a lot of details about how that will work. So this gives you just a big picture of what the SNAP cuts are shaping up to be. We still don't have the budget from the Congressional Budget Office. The CBO is still pending. But this is kind of the information that we have so far coming out of the debates and the information that's been shared. You can go to the next slide. So like I said, the House Rules Committee is still meeting right now and trying to finalize it on the House side. This gives you a breakdown of what the reconciliation bill looks like as it pertains to the SNAP cuts. The state cost share is one of the biggest changes that have come forward in the last week or two. That'll have a major change and impact to the SNAP program. It's still unclear how Congress would pull this off and how states will all of a sudden be on the hook for millions of dollars in costs to the program. They're also planning to cut SNAP benefits for participants, meaning reducing the amount and not looking to increase it moving forward, so taking into effect all of the considerations around diet and cost and beyond. The other area of focus for these cuts are expanding work requirements. Work requirements already exist, and the way that they currently work is really problematic, and so they're trying to expand those even more. They're looking to limit shelter costs and internet support, delaying benefits for people who move between states, and then the other relatively new piece was eliminating SNAP Ed. And in the next couple of slides, I shared some of these details in the past, but just wanted to lift it up one more time and share some of the major changes that would come about from this. And you can move to the next slide. One thing that I had mentioned last week when we met is where the sections of the language comes from for each of these pieces of information. In the last week or two, we've gotten a couple of emails and calls from folks who say, I don't believe this is true. We keep hearing from Republicans that they're not going to cut SNAP, they're not going to cut Medicaid. Shouldn't we believe that? And maybe they're saying that because this doesn't go into effect this year or next year. But I've included these sections that draw out the detail of exactly how they're going to cut the SNAP program. We have colleagues in other states as well who have gone into offices and have had Republican representatives in the House say they're not going to cut them, and then they go and vote and cut the program. So just to give you some very specific information on the state cost requirement, states will now be responsible for 75% of the administrative costs if these cuts move forward. Currently, Tennessee pays 50%. So in 2023, that was $256 million for Tennessee to pay. That will increase to closer to $400 million. Right now, states don't pay people their benefits. That money comes from the federal government. The federal government pays directly onto SNAP benefits, onto SNAP EBT cards. And so with that change, that could be an increased 25% cost to Tennessee, which would equal $315 million that states must fund. So again, all of this is written out section by section, and I've included the link here for folks who want to dive into it. And if anyone is questioning whether or not this is accurate or not, please reach out to us. We're happy to talk about it. And you can go to the next slide. In another section of the proposed reconciliation bill, cutting the SNAP benefit amounts, it will prohibit USDA from making increases to the benefit amount through the Thrifty Food Plan. So what we'll see is that families will see a reduction in their benefits, or it will remain stagnant moving forward. So really sticking to the $6 a day per person to be able to afford food, which is not a lot of money. And you can go to the next slide. And then the expanded work requirements is the other piece where they're planning to make major cuts. And one thing that I wanted to lift up is one of the major changes is expanding time limits to parents or grandparents of children ages 7 and older. Up until this point, families who have children aren't held to work requirements, with the understanding that if you're staying home and working with kids, that's a job. That's something that requires parents to be there for their kids. So they're planning to expand work requirements to families with children ages 7 and older, and then other pieces that we've shared in the past about limiting the waivers for areas of high unemployment and drastically reducing individual waivers. In the past, Tennessee has used those waivers for survivors of domestic violence or folks who are going through reentry programs and struggling to find work. So all of that is a way that Congress is looking to cut funding and cut people off of the program to save money. You can go to the next slide. All right, eliminating the SNAP Ed programs is the other big piece. We talked about this last week, but in the past, Tennessee has brought in $5 million to pay for nutrition education and address obesity prevention and really help people to stretch their benefit farther and focus on healthy eating. This is planning to be scratched completely from the package, and so it would be a major cut to Tennessee and a loss to families. And you can go to the next slide. So direct impacts to the SNAP program. Children are going to lose access to SNAP benefits. Single parents, moms, grandparents who care for children ages 7 and above will lose access to the program. Non-citizen immigrants who are here lawfully, so those are refugees, individuals with refugee status who are here lawfully would lose benefits under this new proposed rule. Low-income households, parents, we've already covered, individuals with disabilities, and other communities will lose. The proposed cuts also have major impacts that are indirect but equally devastating for children who will lose access to school meals. It will reduce availability of the summer meal program to families. Schools will lose funding. This impacts farmers and also harms businesses, also results in job loss. So these are some of the other impacts that will take place if SNAP is cut in the way that they proposed. And you can go to the next slide, and I think I'm turning it back to you, Danielle, to share some of the stories.
Thank you. So thank you so much, Signe, for providing us with that insight. And it's also really necessary for us to see how real people will be impacted if these cuts go through. So I have two stories right here. The first one is from a grandmother in Knoxville. A great grandmother shared that she is raising 5 children on her own. She only earns about $875 per month. It is not enough. She says, thank God, excuse me, for the SNAP program. Another story we have is from a mom in Jackson, Tennessee. She's an underpaid working mom who is barely able to pay the bills and she told her story. If it wasn't for SNAP, I don't know how we would be able to eat every day. Groceries are steadily increasing and I can't pay my bills. So this just goes to show how exactly folks will be impacted. Next slide, please. I will now pass it over to Gordon so he can talk about Medicaid.
Thank you, Danielle. And thanks everybody for tuning in, and particularly those who have tuned in before. We know we're covering some of the same ground, but we want to make sure that kind of the basics are out there, and it's a constantly shifting picture, which makes it more challenging to keep up with. I mean, as Sydney was saying, she was watching the Rules Committee hearing in the House moments before getting on here. It's a constantly evolving drama. Next slide, please. But there are things we know and there are things we don't know. The big picture is still the same. If adopted, the House amendments will cut over $700 billion from Medicaid and coverage under the Affordable Care Act, or Obamacare. And that contradicts, unfortunately, President Trump's pledge that Congress won't touch Medicaid. In fact, he met yesterday. Things have been moving quickly. It's hard to keep track of which day it is, but it was yesterday morning. He had a confab with House leaders, Republican leaders, and really insisted, using a strong 4-letter word, that they not mess with Medicaid. Unfortunately, the bill already contains huge cuts, and to Medicaid. And the Congressional Budget Office, or CBO, is the nonpartisan agency that works for both parties in Congress and is the neutral scorer of how much different provisions are estimated to cut from a program, how much a tax provision will generate in revenues, and so forth. So they're basically the umpires. And to the questions about, can we believe you? We are hearing from Republican members that nothing is being cut. I think the place to look for when you have contending arguments like that, or claims, is to look at what the CBO is saying, because again, it works for Congress and it's neutral. And it says that 8.6 million people will lose Medicaid or Affordable Care Act coverage as a result of these changes, and another 5.1 million will become uninsured as a result of Congress' refusal to extend the enhanced premium tax credits that are going to expire this year. We are nonpartisan. We're a nonprofit. We're nonpartisan. When you hear us referring to Republicans, we're simply reflecting the fact that the Republicans are in the majority and are doing the drafting. And so We're simply reporting, we're not taking a slam at either party. We're just saying this is how it is unfolding. Next slide, please. Between last week, when we thought that the vote in Energy and Commerce Committee in the House sort of settled the matter of what was going to be in the Medicaid cuts, and this week, the bill has moved again in terms of what it contains. The Freedom Caucus, which is the group of hardliners on the right within the Republican caucus, went to Speaker Johnson and said that they would vote against it if there were not deeper cuts. So, and as Danielle was saying at the top of the conversation, the majority is very slim. The Republican majority is very slim. So Speaker Johnson has a very challenging job of trying to herd the cats to all vote as a block, because the Democrats will vote against it all as a block. So he can't afford to lose any Republican members. And again, these different factions make that difficult. We don't have final scoring, which is again, they're sort of the umpires. CBO, Congressional Budget Office, has not scored all the features, in part because they're still changing. So the preliminary estimates are not authoritative, but we have orders of magnitude, general information about the size and the shape of the cuts, the main features. Once it goes to the Senate, after it passes the House, it will become particularly opaque, because over the past week, we have seen markup of which is the process in committees where there's open debate, and the Democrats have put forward amendments and they've been voted down, but there's a lot of discussion of the specific terms. In the Senate, they won't have markup. The committees will just make their decisions behind closed doors. Next slide, please. When we express concerns about the impact on Medicaid and SNAP, it's important to emphasize that there are features of the bill that affect a lot of people, not just the people who are beneficiaries of those programs. Signe referred to the business impact on grocers and communities, but there are other details. This is a huge bill. And buried in it, as is always the case when Congress passes a big bill, special interests tend to squirrel away little nuggets for themselves that often escape attention in the larger hubbub about what's going on. Perfect example here is that there will be a repeal of new nursing home staffing standards that families and advocates have sought for decades to try to improve the quality of care and safety in nursing homes. That's going away. Not really about saving money, and it's not a cut specifically to benefits or eligibility, but it impacts everybody, and it impacts not just the people in nursing homes who are on Medicaid, but everybody who's in a nursing home. It exposes millions of families to medical bankruptcy. So it's not just healthcare, but they may ultimately get healthcare on an emergency basis, but then we know how ruinous medical expenses can be. Next slide, please. The cutting of Medicaid ends up rippling out and affecting particularly rural health, but it affects health care providers. The reason why we talk about rural is because Medicaid is the principal source of funding for the healthcare infrastructure. We're talking about nursing homes, pharmacies, certainly hospitals. And I think probably most people on this call know that Tennessee, unfortunately, leads the country in terms of the rate of loss of rural hospitals. So if you pull billions out of the program, which it will do, the bill will do, that's revenue that right now is keeping a lot of rural healthcare providers and others open. The bill undermines development of drugs for orphan illnesses that can be quite serious, but that are rare enough that it's not commercially advantageous for pharmaceutical companies to do research into curing them or treating them because it's just not a large enough market. Right now, the policy is to subsidize that research. That's going to go away. And most disappointingly, it turns away, it does, the House has adopted an approach. President Trump said that he wanted the savings from Medicaid to come from reducing drug prices, which most experts say is sound, since we pay more for drugs in this country than in any other country on earth, even though most of the drugs are developed, or many of them are developed, and many of them are manufactured here. And President Trump had been pressing Congress to address that instead of cutting benefits, but that's not the way it's turned out. Next slide, please. So let's talk about the Tennessee impacts, because there's a lot of variability among Medicaid programs, and the complexities of the bill that's being advanced will play out differently in different states. The CBO estimates that 77,000 Tennesseans will lose their coverage from changes to Medicaid and the Affordable Care Act. And again, I emphasize this because when people are told by, for example, Republican members of Congress, we're not going to cut Medicaid, that may well be their intent, and they may be saying that sincerely, but I would just emphasize CBO is the umpire, and that's where you ought to go to look for the hard answers. CBO estimates that the number rises to 250,000 Tennesseans losing coverage if Congress fails to continue the enhanced premium tax credits to purchase ACA insurance that will expire at the end of the year unless they're extended. Next slide, please. Another major Tennessee impact is Medicaid expansion. Probably, as most people on this call know, we're one of only 10 states that have denied our residents access to expanded Medicaid coverage under the Affordable Care Act. There are right now in existing law strong financial incentives if the state adopts Medicaid expansion. The mega bill would take those away, and it would dim the prospects for our being able to ultimately convince our state legislature to cover the 300,000 uninsured adults who are currently without insurance. Next slide, please. Work requirements. Signe talked about work requirements in SNAP. There are no work requirements currently allowed by federal law in Medicaid. The bill would, just as it would expand current work requirements for SNAP, it would impose new work requirements for Medicaid. And it would apply to everyone between 19 and 64, unless they're a parent or caregiver. They would have to work or do community volunteer effort to go to school for 80 hours a month. This all sounds fine, except if you look at the actual experience and you look at the practicalities, it doesn't take into account the tremendous paperwork that is required to document your employment week to week, the weakness of state computer systems and infrastructure to process that. In Arkansas, where we did a test of this for a couple of years, most people who lost their coverage were working. It wasn't that they weren't working, it was that they, the state couldn't keep track accurately. And if you want to know what the real impact of this will be, CBO says that it will reduce federal expenditures by $300 billion. And that was before the effective date, which was 2029 last week, and is rumored to have been moved up to 2027 to mollify some of the objections from the Freedom Caucus. Then those savings to the federal treasury, cost to families, will go up even farther. Next slide, please. So there's a Tennessee twist to this, and that is that we already have a state law that was passed in 2018 that required TennCare, our Medicaid agency, to apply for a waiver or special permission from the federal government to institute work requirements here. That was submitted in 2018. It's never been acted on. It wasn't approved by the Trump administration in the first term, and it wasn't approved or rejected by the Biden administration. It's still there. And it's likely, certainly it's possible, that if this bill passes at the federal level, then the state will renew its approval, its pressure on the federal government, and will be well received, I would think, in asking for approval of our waiver. And our waiver is more harsh than what is currently being discussed in the budget bill. It would apply to all able-bodied working age adult enrollees without dependent children under the age of 6. So there's no consideration of whether the person is caregiver for children or adults with special needs. It doesn't take into account whether the only jobs available are less than the cost of childcare and transportation costs, or whether jobs are available. Georgetown University Center for Children and Families projected years ago when this was proposed that 68,000 Tennesseans would lose their coverage. Again, most of those not because they were not working, or in fact, in some cases, working more than one job, but because of the inability of the system to track that reliably and accurately. I heard one expert say that the best way to conceive of work requirements is not really what they are. They are a job loss penalty, because that's the way they actually work. That's their actual effect, is that they take healthcare coverage away from people if they lose their job. Next slide, please. The other major item is just a kind of a host of different provisions that require more red tape to maintain eligibility and create financial incentives for the state to cut people off. And this is particularly significant for seniors and people with disabilities who are on Medicare and participate in the Medicare Savings Program, which covers 250,000 people. It's for Medicare beneficiaries, seniors who have relatively low incomes and for whom it's a challenge to meet the cost sharing requirements of Medicare. It pays the premiums and cost sharing depending upon the sliding scale. That enrollment for this group has been very problematic, and this would continue to keep red tape in the way of those families automatically, or those individuals automatically being enrolled. The government has the information necessary to enroll them. It shouldn't require paperwork, but it does, and under this bill. It will make it harder to keep young children enrolled. Again, there have been movements to make it easier for preschoolers to, once enrolled, to stay enrolled. You know, it's not like they're going to work. It's not like they're suddenly going to win the lottery. Why keep checking their eligibility all the time? It just makes it difficult for families to ensure that they keep the kids covered. And again, it creates financial penalties, which incentivize states to deny coverage. Next slide, please. All of this adds up to sort of a suite of approaches that together demonstrate that you don't have to be explicit. You can just use red tape and paperwork to get rid of people. And the tell for that is our experience in 2023-24, when TennCare terminated 400,000 children and adults, 75% of whom were terminated without a finding that they were disabled, but because they failed to complete the eligibility process. Only 25% of those were actually found ineligible. Next slide, please. So I think our talking points remain the same. We've tried to give you a granular feel of how things have moved over the past week and some of the details, but the message at the large scale is still the same, which is These cuts are going to cost hundreds of billions of dollars. It will affect children primarily, seniors in nursing homes, and people with disabilities. The work requirements are a job loss penalty, which are unfair and counterproductive. The bottom line is that cutting Medicaid funding hurts the most vulnerable people and their communities. Next slide, please. And I'm going to turn it back to Danielle to put a personal face on these larger policies.
Thank you, Gordon. So as Gordon just said, I have a story to share. It says, after spending 3 decades taking care of Tennessee, Sabrina Day Ryder Harper is now asking the state to return the favor. Sabrina is a retired nurse who has worked in various healthcare settings, including geriatrics, hospice, hospitals, home health, and rehab. Her nursing career shaped her views on politics and the world. As she says, as a nurse, you see people from life to death. She understands the importance of healthcare access and its impact on families. Late in her career, Sabrina began experiencing health issues and was eventually diagnosed with multiple sclerosis, which affects her eyesight, memory, speech, and stamina. Additionally, her youngest child has autism spectrum disorder and dyslexia. For Sabrina, having Medicaid means she can receive necessary medication and attend doctor's appointments to slow the progression of MS. She aims to stay as healthy as possible to continue caring for her autistic son. However, Sabrina is no stranger to life without health care. In 2023, she unexpectedly lost her coverage as a caretaker relative. It took over a year for her to appeal and regain coverage. During that time, she had to forego her costly MS medications to prioritize her son's health. She says, I don't care what happens to me. I'm just trying to get this young and grown. Next slide, please. Thankfully, she regained coverage, but Sabrina is concerned about potential Medicaid cuts. She finds it dishonorable and perfidious that Tennessee and federal leaders are even considering such cuts. I have no faith in the political system whatsoever, she says. She has witnessed the devastation caused by lack of health care, whether through coworkers who had to leave their jobs in private duty nursing due to lack of funding, or neighbors who avoid doctors because they are uninsured and can't afford out-of-pocket expenses. Sabrina fears for the future, especially for the ones that come after her time is done. Without coverage, her MS would progress more rapidly, potentially causing her death while her son still needs support. She wonders about who would meet her son's complex needs as an autistic individual. She wants to leave something behind for her children, but worries she won't be able to if her medical expenses continue to grow. Additionally, she worries for her community, where high addiction rates could worsen if people can't access proper treatment. Saving Medicaid is crucial for people like Sabrina, allowing them to continue raising their children and keeping communities healthy and strong. Someone like Sabrina, who has devoted her entire life and career to caregiving, should be able to afford to care for herself and her family. Next slide, please. So, what do we do now? Senators will be looking to see how things happen in response to the passage in the House, so it's very important that we show that cutting Medicaid and cutting SNAP are massively unpopular opinion and things that we do not want. So some things that you can do is you can write a letter to the editor of your local paper, make it short, make it civil, stating hands off Medicaid and why that should be the case. Another thing you can do is call Senators Blackburn and Haggerty at this toll-free number right here. And if you've already done it, do it again and ask your friends, your family members, anyone else that you can think of to call as well. Next slide, please. So we are moving to our Q&A section. Thank you to those of you who have already put your questions in the Q&A box. But if you have not, you can follow the instructions on the screen. Look for the Q&A icon in the taskbar. Click the Q&A icon to type your question into the box, and you can choose whether to submit it anonymously or with your name attached. So while others are still putting their questions into the chat or into the Q&A box. I have a couple that are already there, and the first one I'm actually going to pass to you, Gordon. It says, can you comment on the level of disagreement from moderate Republican congresspersons from blue states and how strong it is?
Sure, and thank you for the question. That's difficult to gauge. I've had friends who are close to the situation in DC, former staffers, lobbyists, and I've asked that question, and I've asked it also about the Freedom Caucus, which is the group of hardliners who are wanting to cut more. And the answer, we are, after all, talking about politicians. It's hard to tell how much of it is performative, how much they are wanting to be able to tell their constituents, oh, I took this position, and where their actual red line is, where it will determine that they would walk away or vote against. There's no doubt that some of the members are very sincere and very on both sides, but it's just difficult to tell where their vote will come down, particularly with President Trump putting tremendous pressure and threatening that there's no future in the Republican Party for anybody that votes against the bill. So, we won't know. That's what makes this such a nail biter, is that in both the House and the Senate, when I wrote my slides yesterday, it was expected that it would go to the House floor today as a result of more disagreements that I won't go into here because they're kind of niggly and they change by the minute. But now it seems unlikely that it will go to a floor vote. So we don't know. But there is this tremendous tug of war between the moderates and the hardliners, and it's not clear who will blink or if President Trump and the pressure from the party will ultimately force the two sides together so they can get it out of the House. It was expected that it would go to the House floor today and be out of the House on its way to the Senate before Memorial Day, which has been the deadline that was set at the beginning of the year. Now that's looking less likely. Every day that it is delayed is good, and it reflects not just the reason why there is this tension between the different factions within the Republican Party. Is the reason why that tension is as great as it is because of the pressure that's being applied from the outside. The calls, not just in blue states, not just in red states, but generating the calls and the emails to members of all backgrounds saying, and remember, the polling shows that 76% of Americans, including a majority of Republicans, favor the Medicaid program and want it either expanded or preserved. Solid majority of Americans want the SNAP program preserved. So a lot of this is inside baseball, and the public's, the task for us as Americans is to let our elected representatives know, please reflect our values. We don't want these programs cut. That's getting through and it's sort of like turning up the heat under a pan of water. These tensions between the moderates and the hardliners just get more and more intense the more they all feel the outside pressure. The hardliners are, of course, getting pressure from their base in their districts that are saying, don't add to the deficit. So, and I don't want them to add to the deficit either, but I don't want them to fund the tax cuts at the expense of the safety net. So it's a very minute by minute drama, and we can't know exactly where the members will be. And in fact, the speaker doesn't know until where the members will be until it gets to a vote.
Okay, thank you so much for that, Gordon. I have another question. This one is for you, Signy. This is from Claire. She says, our organization works specifically with refugee populations and other authorized non-citizen populations. You mentioned these populations may lose access to SNAP benefits. Can you share a bit more about how these populations may be affected specifically?
Yeah, through the cuts, they're looking specifically to undo the existing rules that allow for refugees, asylees to be able to access these programs. So directly that way, and then indirectly just through other the other impacts that are happening around the country. I think a lot of immigrant families who would be eligible are not applying. So children who were born in the United States should be eligible to apply, but a lot of families are not. But through this bill, they're looking to undo a lot of the provisions that exist for immigrant families.
Thank you. My next question, I'm actually going to start back with you, Signy, and then throw it to Gordon. It says, how can we activate Republican Tennessee constituents to call and protest these cuts?
Yeah, I'll start, and then I'll throw it back to Gordon. I was in DC last week, and we visited all of our Republican representatives and shared information. I think it's really, really important just to repeat the facts of what is happening and what is in the language of the proposed cuts, and to hold their feet to the fire and push back when they say there are no cuts that are going to take place. I think the other thing that has been really helpful for us is being able to bring constituent statements, and not just people who participate in the SNAP program themselves, but also anyone who works directly with clients being able to share how moving forward with this will impact their line of work and the people that they serve. And so that's what I would say. I think continue to pick up the phone, continue to email. It's all working, and they need to hear from us and continue to let them know that these actions have effect. The other thing that I would say, when this vote comes through, I think reaching out to folks who vote yes to say vote yes versus no. Thank those who have opposed the cuts, and make sure to say you're disappointed if the representative continues to vote in favor of cuts. Yeah.
I would just second what Signy said. Yesterday, I went online, went to my favorite doctor, Dr. Google, and just put in the search bar different organizations' statement regarding budget bill, and download it, and we will compile these and send these out. We're going to circulate this program, and we'll send with it a compendium of those. I mean, from the American Cancer Society to Feeding America, all of these nationally respected organizations have uniformly said, please don't do this. And I think that's one thing to do, is to, if you're talking to Republican friends or relations, in addition to invoking the Congressional Budget Office, which is kind of wonky, I would just say, look, we understand Congressman so-and-so is saying this isn't going to cut. We're not saying he's intentionally misleading, but here are the facts. Look at what the American Cancer Society has said. Look at what Feeding America has said. Look what No Kid Hungry is saying. Look at what major religious leaders are saying. They know what they're talking about, and this is quite serious. And again, remember, in spite of the political divisions, most Americans agree on basic values of caring for neighbor, and the polling shows that these safety net programs have the support of Americans of both parties.
Thank you. I have another question that reads, has the House bill laid out how able-bodied is defined for the purposes of Medicaid work requirements? Will people on SSI be automatically exempt, do you think? Gordon, I will let you take that.
Yeah, that's not spelled out. That's the sort of thing that would be likely spelled out in regulations. The in all probability, people on SSI would be automatically exempt. The problem is with the term automatically. By law, they would be exempt, but this goes back to the point that we were trying to make earlier, which is experience shows that state bureaucracies and their computer systems don't have a great track record of recognizing people as exempt who are supposed to be exempt. So you can be on SSI, you can be entitled by law. Your state Medicaid agency can get regular information from Social Security saying that you're receiving SSI, but we know from experience with TennCare, that's no guarantee that you'll be recognized as actually receiving SSI and therefore being exempt. So good news, bad news. Good news is SSI will almost certainly be exempt. Bad news is, like everything else, it depends upon the accuracy and reliability of the red tape machine to recognize that.
Thank you. We might have time for one more question, and there are two that are very similar. They ask, can you give the effective date for the cuts at present, or a simple timeline? And I'm going to pass it to you, Signy, first, and then Gordon, if you have anything to add.
Yeah, I can start with some of the work requirement pieces that would go in effect immediately. Things that they can put into practice right away, they will do. So that includes the work requirement piece. The pieces for that's for SNAP, and for this cost share piece and attached to the benefit amount. And taking away SNAP Ed, right now they're saying 2028 for those pieces to go into effect.
Medicaid provisions, it's a moving target. These things continue to be renegotiated. The work requirements were to take effect in 2029. The reports are that the Freedom Caucus pressure has caused those to be moved up to 2027. Different provisions have different features. Generally speaking, the strategy has been to put off the things that will really bite until after the midterm elections in 2026, so that it doesn't affect, it doesn't cause a backlash. People don't feel the cuts before they have to go to the polls and vote for congressional members in the fall, 18 months from now. So it's all over the map and it's subject to change. Generally speaking, you won't feel it immediately, if only because the majority wants to get through the 2026 elections first.
Okay, thank you both. I would like to provide time for each of you to provide any last final statements that you would like to say, and I can start with you, Gordon, because you are off mute.
Thank you. Just again, thank you all for hanging in and for continuing to tune in and for continuing to maintain the pressure. I know that it gets discouraging when we keep coming back and saying, oh, our hair is on fire, Chicken Little, the sky is falling. I'm not saying that my hair is on fire for obvious reasons, but it is a sky is falling situation, and there's good news, bad news. The bad news is this bill continues to advance, and it will be catastrophic if it is ultimately enacted. That's the bad news. The good news is the difficulties and the shifting provisions reflect the fact that there really is an impact being had. The fact that the president said, don't, in coarser language that I'm using, don't mess with Medicaid, is evidence that they are sensitive to the public response to this. And we just need to keep reminding our officials that It really is unpopular. It really would be bad. We really do need for them to keep their hands off of Medicaid and SNAP.
I'll echo Gordon's thanks. Thank you everyone for being here and for your continued efforts. And I'll just say, continue to keep up the pressure. That the focus has really been on the House. For those of you who continue to reach out to the House and the Senate, you're ahead. For anyone who's been focusing on the House, I would say start talking to your senators, because they're going to be up next and will be doing their work to move the bill forward. So keep those calls going out to your legislators, and keep in touch with us, and let us know if there's anything we can do to help in your communications to legislators.
All right, thank you both so much. As you can see on the screen, we do have our contact information. I know there were a few questions that were not addressed, unfortunately. I want to be cognizant of everyone's time. So if any of those questions that were not answered, please feel free to reach out to any of us. And then you can move to the next slide. Just a thank you that has been said already. I just want to reiterate it. We really do appreciate when you all come on here and engage. And until next week, we'll see you again. Have a great rest of your week.